Hi guys, it's Dr. Kelsey here. I am on with one of my colleagues, Dr. Erin Thorne, and we are going to be talking today about alcohol. So, Dr. Thorne, why don't you introduce yourself and tell my audience a little bit about who you are and what you do?
Great. Thank you so much for having me. So I'm Dr. Thorne. I practice here in Seattle, Washington, and I primarily work with women and men that are reclaiming their lives after alcohol. And so they've given up alcohol and they're rebuilding back their bodies, their thyroid, their digestive system, because as most of us know, alcohol really has no place in the body and it wreaks havoc on our entire system. So that's primarily my focus, and I am a naturopathic doctor as well.
Great. So I am mostly interested in talking to you today about how alcohol impacts the immune system, because right now, there's a lot of extra drinking, I think, that's going on with people having so much extra time on their hands.
Are you referring to the virtual happy hours?
Yes, and virtual happy hours and lines around the block at the neighborhood alcohol stores. So I just want to talk about this because I know you and I both know as naturopathic doctors that alcohol can be hard on the immune system. And so I want to hear from you what you know about that.
Yeah. So first off, we all have an immune system that is naturally intact and naturally innate and able to detect any sort of viruses or bacteria that we encounter on a daily basis. So alcohol, lots of research to support that it actually knocks out your immune system acutely drinking for 24 hours. And then if you're a chronic drinker, it knocks out your immune system for even longer. And so right now, it's not an ideal time to be knocking out your immune system, especially with this virus, and we don't know a whole lot about it.
Right, right. And I know I've heard some of your other videos that you've been talking about this and specifically how alcohol affects the gut. And I know we always talk about how the immune system is really housed in the gut, and how we have all these little cells that are in the lining that basically secrete chemicals that digest bacteria or digest, problematic things. So how does excessive drinking affect immunity through the gut?
Yeah, so just like you said, we all we're aware that there's a microbiome. Everyone has their own individual microbiome made up of beneficial and commensal, meaning that they're good bacteria and bad types of bacteria in there. And so alcohol actually promotes the bad type of bacteria. Two of those being H. pylori, and then the other one being yeast, which is not a bacteria but another type of microbe. And alcohol kills actually the beneficial bacteria. I always like to use the analogy that like alcohol we use to sterilize wounds and surfaces, and what do you think it's doing to your gut? It totally shifts the microbiome in your gut. And it causes a lot of inflammation, so alcohol is very toxic. When alcohol goes in a wound and it's like, ooh, that stings. You have like a lot of raw type mucosa, which is like your cells in your gut, that just take on that alcohol when you drink it. And it actually causes these cells to become very leaky and inflamed. And you want this barrier, these cells lining your gut, to be intact because they're there to protect you from viruses, bacteria, any other sort of particles or chemicals to go into your bloodstream. And if it goes into your bloodstream, your blood goes all around your body, and it delivers whatever toxin or virus is in your body and your blood to everywhere. So not great.
Yeah, that kind of like is a little bit more gross when you say it that way. So one of the other things that I know a lot of people are talking about right now are nutrients. And I think people are talking about them a lot in terms of supplements, but I think we can still put that aside and just talk about basic nutrients that we get from our diet or basic nutrients that are in our body that we're supporting or depleting. And are there any nutrients that you would highlight as being at risk of depletion with excessive alcohol use?
Yeah, so my two favorite ones are B6 and zinc. So B6 and zinc we know are rapidly depleted with alcohol consumption. The liver just like burns through your B6 and zinc super quickly. And B6 and zinc actually are responsible for making your serotonin. So which is why a lot of people get anxiety and depression, and that's associated with drinking alcohol. So I do like those two nutrients the best because alcohol does burn through them. But zinc.
It's actually really interesting. I'm going to interrupt you because I think that's so interesting what you just said about it being useful for serotonin production. And serotonin, 95% of our serotonin is produced in the gut,
Yeah.
right? And so we're seeing this inflammatory thing coming in the gut and affecting the nutrients that help us produce serotonin. And serotonin is the hormone that makes us feel good and feel relaxed.
Yeah. Serotonin makes us feel very calm. It's the most common SSRIs are the most common antidepressants prescribed, and they increase the amount of serotonin in our brains. So when we start messing with serotonin levels, it leaves us, to be more anxious and uncomfortable. And right now, I don't really want to feel any more anxious about what's going on right now. So
Yeah, I think that's a great point. So the biggest thing people are talking about currently is the impact on people's lungs. And so do you have any thoughts about how alcohol may be affecting lungs, or how, what's going on there?
yeah, I mean, so we have lots of barriers on our body. Our skin, our outer layer of skin is a barrier to the outside world. And then our gut has a lining to protect us, to protect our blood stream from getting toxins in it. And then our lungs also have the same type of protective barrier in it. And there's actually research to show that drinking alcohol, even acutely or chronically, acutely in those like happy hours, impacts the microbiome in your lungs. And those bacteria in your lungs are responsible for gobbling up the viruses or sending signals actually to your immune system to say, hey, there's a virus here, like, let's take care of this. And the alcohol actually thins and changes the consistency of the mucus in your lungs. You actually want a good amount of mucus in there because the mucus holds and nourishes that bacteria and that immune system in there. So alcohol knocks out that mucus. So not great for the lungs, especially with a virus that's really hitting the lungs pretty hard.
Yeah, so that's really interesting. I want to talk about the mucus a little bit, because I actually did another video earlier with somebody talking about mucus and how a lot of what people are experiencing with the lung issue is almost too much mucus because of the fluid production from inflammation causing problems with oxygen exchange. So, but what I'm hearing from you is that the alcohol can actually make too little. So there is a happy place in the middle.
Yes. Our gut has a mucus layer in it where a lot of our immune cells communicate with our bacteria. It's kind of like this medium that they talk to each other in, and the same with the lungs. The mucus is actually very nourishing to a lot of our cells and to the bacteria. So there is a sweet spot. You do need a little bit.
Okay, great. So, I think the last thing I'm curious about is, I think the reason that people are drinking more acutely right now is because we're bored, right? We have all this time on our hands. We're not able to take part in the activities we typically do. There's also higher levels of anxiety right now that certainly lead people to drink more. And people are now in situations that they maybe aren't used to being in, which obviously causes stress, and alcohol is a great tool for distraction. So I'm curious, if this is something I talk to my patients about, but what are you telling your patients that they can do in terms of trying to mitigate that anxiety or deal with all the time that they have on their hands?
Yeah, I mean, to back up, like the one thing is that if you have anxiety and depression about this, alcohol is kind of, Laura McDowan is on Instagram, and she calls alcohol throws anxiety or gasoline on your anxiety. So
Yeah.
it's going to really make the anxiety and depression worse and make you feel more helpless. And really, we want to feel more empowered and really take advantage of this, time that we have now, so we are in quarantine or we are social distancing, but I'm encouraging my patients to see this as an opportunity to really reflect upon their health and actually take time to spend time with their families and take on, a new exercise routine and actually start repairing their bodies, from just this constant go. So it's really scary, and it is a little bit scary, but it also is a time for us to repair and reflect. So I'm trying to focus on.
Yeah, I feel like there's so many of us have, the ever growing to-do lists that are sitting on the side of our fridge or our counter or in our phones or something. And, I kind of feel like now is the time that the excuses of getting to those are they're no longer valid. It's like you have nothing but time
Yeah, exactly.
to work on those projects or to take up a new skill that maybe you've been waiting
Yes.
for the right time
On
to
the
do.
other side, though, just for the moms that are listening to this, we don't have that much time. We're learning how to run a daycare in our
Right,
house.
that's very fair. Did not mean to be insensitive to that.
It's all right.
Very
Just a
fair.
little sensitive.
It's restructuring. It's
Yes,
different time.
exactly.
Well, that's a great point. So I guess like as a mom yourself, what are your thoughts on how this has changed your life because this has affected so many people with their kids having to be home. So can you talk a little bit about that?
I mean, I appreciated someone sharing this on social media, and and I think a doctor wrote this to a doctor, or a daycare center wrote this to all of the participants at the daycare, and they were like, this could be the best time that your kids could ever have with you, because they're really getting this like one-on-one, high quality, 100% you time, that they
Yeah.
get. Usually they're rushed out the door at 7 a.m. to head to daycare, and they go through this rigmarole at daycare, and then they're rushed home to do dinner and nap and nighttime routines. So it's nice for them. Yeah.
Yeah. That's
And
great. That's actually a really great way of looking at it.
yeah, I
I
appreciate it.
think that's all I had today to ask you, unless there's anything else you want to add.
No, I don't think so. Thank you so much for having me.
Yeah, it was really wonderful having you on today. And if you guys are interested in following Dr. Thorne, how can they follow you or hear about what you're doing?
Yeah, so my Instagram handle is at Dr. Erin Thorne, and then my website is drerinthorne.com, and I have a couple handouts. One is 5 key nutrients for post-alcohol healing, and then 15 ways in 15 days to optimize your health and get to the root cause. So if you're
Great.
interested. Yeah.
That's awesome. Okay. Well,
All right.
thanks so much, and we'll see you next time.
Cool. Thank you. Bye.
Bye.